Bismillahir Rahmanir Rahim. Assalamu alaikum, my dear students. Today's topic is DNS. The word DNS implies deviated nasal septum. We also call it deflected nasal septum. So either you call it deviated nasal septum or deflected nasal septum, it's one and the same thing. And DNS is one of the most important causes of nasal obstruction. In the whole world, DNS is very common, and deviated nasal septum can involve about 95% of the population. But the thing is that not all types of deviated nasal septums require a treatment, since they don't cause a symptom. It's only those types of DNS or deviated nasal septums which cause a pathological problem, which cause symptoms to the patient, that we actually treat. Okay, so let's go ahead with our topic. Bismillahir Rahmanir Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. My dear students, today I'm going to talk about deviated nasal septum. It's also called deflected nasal septum, but in short, it's usually called a DNS. Well, deviated nasal septum or deflected nasal septum is a deviation of nasal septum from midline. Common condition affecting more than 95% of population. It may be asymptomatic or symptomatic. It is an important cause of nasal obstruction in human beings. When we talk about etiology or the causes of DNS, we can subdivide that into two. One is congenital and the other is acquired. Among the congenital ones, one has got hereditary or familial causes, or the type of DNS occurring during pregnancy, and the type that may occur during childbirth. While the acquired ones, one can talk about trauma causing a DNS, as well as developmental causes and space-occupying lesions causing a DNS. Now, taking these in a very little detail, certain types of DNS may run in families, and there is a hereditary tendency in those families to develop a deviated nasal septum. While during pregnancy, one would wonder, why would during a pregnancy a DNS would occur? Well, the thing is, during pregnancy, the fetus is subjected to three kinds of pressures. One is the abdominal wall itself, putting pressure on the fetus. The second is the abdominal musculature. Third is the uterine musculature. And one can talk about the fourth, which is amniotic fluid, putting pressure on the fetus. If the fetus head gets engaged in the pelvis, a lot of pressure occurs on it, and if the face is presenting, then naturally the pressure is put on the face itself, and that face may in turn buckle the inside nasal septum. While during childbirth sometimes one delivers a child with forceps, and when the forceps are applied, the doctor doesn't usually see where the forceps is being applied, and sometimes it's prongs, the forceps prongs usually applied on the face, and it's putting pressure directly on the nose itself, and that pressure during childbirth may itself cause or press on the nose and cause a DNS during childbirth. Talking about the acquired ones, trauma directly occurring to the nose. Well, trauma has got types, usually physical type of trauma. That is, there could be either accidental type of trauma, or it could be surgical type of trauma. It could also be an assault. Now, physical type of trauma due to accidents may occur during life, any time during life, and road traffic accidents are the commonest of examples. While a fall during a walk, a foot may catch on something and a patient may stumble and fall. In that way, one may hit the curb or the floor and cause trauma to the nose. That's accidental type of trauma. While assault, anyone can punch a nose, someone else's nose, and other types of trauma one can find during an assault is usually blunt, like clubs or a stick hitting, or a punch hitting the nose, and that can break the nose itself, and in turn the nasal septum may also break and cause, in turn, if that is not replaced or reduced in time, that may result in a DNS. Trauma directly does not result usually in a deviated nasal septum, but it can fracture the nasal septum. It can, the fragments may go to one side or the other of the nose or nasal cavity, and then if that is allowed to heal in that particular position, DNS or deviated nasal septum results. While developmental means there is discrepancy in the development of the face or discrepancy in the development of the nasal septum in relation to the nasal bones. Sometimes the nasal septum grows faster than the nasal bones themselves, and in turn, when the nasal septum grows faster, it doesn't get much room to grow straight, and then if it grows faster, then it can buckle or bend, and that results in a kind of DNS. While space-occupying lesions may also cause a DNS, but that takes time, usually 5 to 10 years of space-occupying lesion, putting pressure in one nasal cavity and putting pressure on the nasal septum may cause its deviation to the other side of the nasal cavity. Developmental errors like unequal growth between palate and base of skull may cause buckling of nasal septum. While in mouth breathers, one may also face developmental errors, and that can result in a kind of DNS. Cleft palate and cleft lip deformities may lead to mouth breathing and underdevelopment of the nasal septum, sometimes a deviation of the nasal septum along with cleft lip and cleft palate. While dental abnormalities can also result in deviated nasal septums. Now, here is a picture of deviated nasal septum along with a CT scan of the sinuses and the nasal cavity. And the picture itself shows a deviation of the nasal septum inferiorly towards the right, while the other swelling visible right in front is the middle turbinate, and below the middle turbinate on the right side anatomically is the right inferior turbinate. While when we look at the CT scan, it shows two maxillary sinuses along with the nose and the nasal cavity, and the midline septum has gone over to the right side with a roomy nasal cavity on the left. While talking about the types of DNS, there are quite a few types of DNS one can talk about, and it may involve the cartilage or bone or both. Now, talking about types of DNS, one has got an anterior dislocation of the septum. That is, septal cartilage may be dislocated into one of the nasal chambers, and that anterior dislocation can be caudal dislocation into the columella, while C-shaped deformities of the nasal septum is deviated in a simple curve to one side. Nasal chambers on the concave side of nasal septum will be wider and may show compensatory hypertrophy of the inferior turbinate. While an S-shaped deformity of the septum, it may show an S-shaped curve either in vertical or anteroposterior plane. It may cause bilateral obstruction. Since the obstruction is an S shape, it causes a deviation to one side as well as the other and causes bilateral obstruction. While a spur is a shelf-like, often sharp projection found at the junction of bone and cartilage. A spur may press on the lateral wall and give rise to headache. It may predispose to repeated epistaxis from the vessel stretch on its convex surface. Thickening of nasal septum may be due to organized hematoma or overriding of dislocated septal fragments, which later on give rise to the impression of a deviated nasal septum. Now, the clinical picture, clinical features. DNS can involve any age and sex, while males affected more than females. Talking about in general, a DNS can give rise to nasal obstruction, headache, sinusitis, epistaxis, hyposmia or anosmia, external deformity of the nose, and middle ear infections. While nasal obstruction is obviously due to the deviation itself. The cavity, the nasal cavity side, which has got the most part deviated into it, is narrow, whereas the other side of the nasal cavity, which is, say for example, if the right nasal cavity is narrow due to the deviated septum, the left nasal cavity may be roomy or spacious, and that can give rise to unilateral type of nasal obstruction. But later on, when the DNS has become old, then in that case nasal obstruction can become bilateral as well, although it had been unilateral to start with. It's because of compensatory hypertrophy of the inferior turbinate on the side where the nasal septum was deviated to the other side. Headache may also occur due to pressure of the deviated septum on the inferior turbinate. Sometimes the spur itself is pressing on the inferior turbinate and causing pressure sort of headache. But it can also cause a type of neuralgia, like Sluder's neuralgia is a type of headache or neuralgia which is due to a pressure of a spur on a nerve element or a nerve branch on the inferior turbinate. Now, sinusitis can also occur because DNS, deviated nasal septum, causes nasal obstruction, and because of the nasal obstruction, there is a stasis of secretion in the nasal cavity, and that secretions or those secretions act as a culture medium for bacteria to grow in, and those bacteria in turn cause rhinitis and sinusitis in turn. Epistaxis can be due to either the stretching of the mucosa of the nasal septum over the spur, sometimes due to trauma on the spur, and sometimes due to recurrent infections inside the nasal cavity. While hyposmia, which is reduced sense of smell, or anosmia, which is loss of sense of smell, that can also occur because of nasal obstruction, since the air is not entering the nose properly or is not going towards the olfactory mucosa. One may feel hyposmia, reduction in the sense of smell, or sometimes if there is total obstruction, one may complain of loss of sense of smell. External deformity may also occur if usually it's because of trauma which has not been dealt with in time, or is due to developmental deformity of the nasal septum, which takes the nasal bones along with its curvature and causes a crooked nose as well. Now, middle ear infections can also occur because of nasopharyngeal infections, and nasopharyngeal infections in turn lead to eustachian tube problems and in turn middle ear infections. Now, talking about effects of DNS, I just told you about on external nose that a deviated nasal septum can deform the nose externally as well. Since the internal wall is deformed, it can take the outer wall, which is the nasal bones, with it and cause a deformity. While on nasal septum itself, it could be either a C-shaped curvature or an S-shaped deformity or a spur, which in turn leads to deformed nasal cavity, which may have some room in one side, while it may be totally or completely blocked on the other side, while adjoining tissues may also get their branch of this deviated nasal septum in the form of infections which may spread to either the middle ear, or it can spread to the nasopharynx or pharynx or larynx or the tonsils, like that. Now, symptoms we talk about can be divided into two. One, due to obstruction in an air passage. One can have inability to breathe or difficulty in breathing through the nasal cavity, which could be either unilateral or bilateral, depending on the type of DNS. While bleeding from ulcerated mucosa may also occur because a spur may have repeated trauma over the surface and can bleed. While external nasal deformity can also occur in cases of DNS, and the patient may present in the clinic with an external deformity. And when the patient is examined, one finds that there is an internal deformity of the nasal septum causing an external deformity of the nose. Now, change of voice can also occur because of it is in the form of rhinolalia clausa, means blockage of the nose leads to a dead voice or a change in voice, which is not normal. Now, pressure headaches, I told you about, can also occur due to pressure on the ostia of the sinuses, blocking the ostia of the sinuses with less air getting into the sinuses, causing headaches. While decreased sense of smell can also be because of decreased entry of the air into the nasal cavity. Now, symptoms due to obstruction of nasal secretions and spread of infection, which can be in the form of sinusitis, which is inflammation of the mucosa of the sinuses. Otitis media is inflammation of the mucosa of the middle ear, while tracheitis is inflammation of the tracheal mucosa. Laryngitis is inflammation of the laryngeal mucosa. Pharyngitis is inflammation of the pharyngeal mucosa. Tonsillitis is inflammation of the palatine tonsils or nasopharyngeal tonsils. Mental retardation can also occur if the DNS has occurred from an early childhood or infants. Mental retardation due to less air getting into the nose, less air getting to the blood, causing hypoxia and mental retardation. Well, we look for signs of the nasal deformity inside the nasal cavity, which is the nasal septum, and nasal obstruction, and to what extent it has occurred we can easily see, either through clinical examination if that is not proper, or if the septal deviation is such that one cannot actually see deep in the nasal cavity, one opts for nasal decongestant drops, which then shrink the mucosa and may give you a better view inside the nasal cavity to see the site of obstruction. And if possible, one should do a nasal endoscopy as well, which is through a nasendoscope, flexible type, which gives you a very good view of the nasal cavity itself. While the shape and site of deviation must also be looked for. And the shape, I told you, can be C-shape or S-shape or S-spur, and the site of deviation can be either cartilaginous or in the bones, the vomer bone or the perpendicular plate of ethmoid, or both. Now, shape of nasal cavity would be determined by the type of deviations, whether the nasal cavity is totally blocked or it's partially blocked. While airways can be checked whether the patient can breathe through the nose at all or can breathe through the nose in a decreased sort of or diminished sort of manner, like one airway may be more blocked than the other side. While the state of turbinates also looked for, maybe the inferior turbinates hypertrophy on the site opposite to the deviation, which is if the right side, there is a right-sided DNS, then the left-sided inferior turbinate may also hypertrophy and cause an obstruction in turn on both sides. Any coexistent infection or disease will also be looked for. Now, investigations for a DNS case can be that one has to look into the nasal cavity properly, and to look properly, one sometimes sees better with a nasal endoscope under local anesthesia, which gives a very clear view, and sometimes it's better to look at it on a monitor. Now, routine blood tests, if surgery is planned or infection is suspected, like for example rhinosinusitis, one goes for routine blood tests as well. And X-ray sinuses like occipitomental and occipitofrontal views to see bony deviations of the septum, as well as to see signs of sinusitis, are helpful. Treatment of a DNS. If it's asymptomatic, then no treatment is required. While if a patient has got symptoms, then the treatment is either a submucous resection operation, which is also called in popular terms an SMR operation, or one can go for a septoplasty. Thank you very much.